Okay, this video is what is the best way to treat back pain, and we're going to talk, initially based on the lumbar spine. This is the lower back, but it applies to the rest of the spine as well. So this would be your L5, lumbar vertebral body number 5, L4, L3. This is the abdominal aorta. The abdominal aorta gives off a branch called the lumbar artery that goes to the lumbar spine. It runs about mid-height of the vertebral body, drops a small twig down to the lower end plate and the upper end plate. The disc is alive. It runs on anaerobic glycolysis, and it extrudes its waste products, plus it gets its glucose by diffusion from the adjacent end plate, the adjacent part of the vertebral body. So the point I'm going to make here is that when we talk about the human body, everybody knows, your brain gets damaged by lack of blood flow. Ischemia is the medical word for lack of blood flow. Everybody knows that the Johnson stops working if it doesn't have enough blood flow. Okay, everybody knows heart disease is a lack of blood flow to the heart. But very few people are aware the most common problem with the spine is also a lack of blood flow. Now, don't get me wrong, the spine is complicated. There's a lot of things that can happen in the spine, but most common problem, I look at these things every day, is a lack of blood flow. And we're going to explain a little bit about what that's all about. Okay, this, by the way, is the disc space. Here's the vertebral body. The adjacent part of the vertebral body is called the end plate. And I'll show you the anatomy on another picture in just a sec. But this is an important point, that there's not a lot of blood going to this end plate, and there's very little going to the disc, even under relatively good conditions. Okay, here's another picture of the lumbar spine. This would be sacral vertebra 2, sacral vertebra 1, we call it S1. This is L5, 4, 3. All right, so here's a Schmorl's node, which just means the disc can herniate into the vertebral body. We call it a Schmorl's node, or intervertebral body disc herniation. Here's a disc herniation posterior into the spinal canal. When it goes above the upper or lower margin of the disc space, then it's called an extrusion, which means a bigger disc herniation. When it's just at the level of the disc height and just goes straight back posterior, that's called a protrusion. And these words, protrusion and extrusion, are almost like code words to say big disc herniation or small disc herniation, with the thought being that an extrusion is more likely to be recommended for surgery. It's a bigger problem. It's going to be theoretically less likely to resolve on its own the amount of pain or symptoms from it. This word right here is epidural lipomatosis, and that's because the dural sac is right in the center with the nerves, and right around it's called epidural. And some people will deposit a lot of fat into their spinal canal, so that's called epidural lipoma, meaning fat, ptosis, meaning a lot of something in a place. So epidural lipomatosis. And fat can actually cause back pain in a couple different ways. First of all, you're carrying more fat, that's more pressure on your disc. Secondarily, it can fill up this epidural space and cause compression of the nerves in the dural sac. Thirdly, it's associated with atherosclerosis and ischemia, lack of blood flow to the spine. So those are some of the ways that it can worsen back pain. Also, you tend to be a little bit more inflamed if you have if you're obese. Okay, so we just talked about this, how ischemia, lack of blood flow, is also number one cause of going blind, of having hearing problems. Of course you can get hearing problems from a lot of exposure to a lot of noises, but just from getting older and atherosclerosis, you get hearing problems from that. Okay, so that's a key point, that lack of blood flow is the most common problem in the spine, all right? And now I'll talk about some of the other problems in the spine. You can injure the discs from trauma, like a car accident, lifting super heavy weights, doing deadlifts too heavy a weight with poor form. Some jobs require a lot of awkward positioning. I've seen some car mechanics that kind of injure their backs from all the awkward positions they get themselves into. So those are some of the ways you can develop problems with your spine. And sometimes nobody knows why, they just herniate a disc. Okay, what are some of the treatment methods for the lumbar spine? You can rest, but you can only rest for a little while. Sooner or later, you got stuff you want to do, and if you rest for too long, you get osteoporosis. The bones start to demineralize. Walking, if you're able to walk, is often good because it gets more blood flow to the spine. It kind of milks out the waste product and facilitates diffusion of the glucose into the disc. Physical therapy sometimes can help. Chiropractor sometimes can help. Acupuncture can get the person's mind off at a TENS unit, like transcutaneous electrical nerve stimulation. The gating theory of pain is that if you're having a big stimulus to the back, like a massage or something, it sends so much neural input towards the spinal cord and brain that it sort of overwhelms the pain signal, and in a sense it distracts the patient from their pain. Patients with more chronic and severe pain will sometimes go for nerve blocks, injection of local anesthetic and epidural steroids. Open surgical procedures can be performed. But what I'm saying is, too, in the long run, it really helps. Just get this stuff straight: the diet, the exercise, the sleep. And don't sit too much. If you can get a standing desk, get a standing desk. If you have to sit at your desk looking at a computer, for example, make sure you stand up as much as you can and walk around the room wherever you are just to get a little bit of exercise. I'm going to go into a little more detail about why diet and exercise are so important for taking care of the spine, because when the spine disc is injured, like let's say it's ischemic, the outer part's called the annulus fibrosus, which is like a steel-belted radial tire. And when that's ischemic or traumatized potentially as well, I think ischemia is by far the most common cause, but that will fail. And when it cracks, the central part is like the center of a jelly donut, and that will leak out. And so a leakage of the nucleus pulposus, the jelly donut-like part, through the hard annulus fibrosis part is called a disc herniation. And we referred to the specific names: disc protrusion, disc extrusion for a bigger one. So basically, you don't ever want this annulus fibrosis to get ischemic in the first place and to be damaged. There's other things that can also damage the spine. If you're eating a lot of that processed food with the glyphosate, that is glycine phosphate, and that can substitute it in for collagen. Collagen has repeating sets of 3 amino acids, including glycine, every third residue, and you can substitute in glyphosate in there, and that is thought to damage the collagen and predispose to problems with the spine. Fluoride also can damage the collagen proteins of the spine and cause problems, because there's a lot of big ligaments. There's an anterior longitudinal ligament runs up and down the spine anteriorly, posterior longitudinal ligament runs up and down the spine posteriorly, right on the posterior surface of the vertebral body, and then there's a ligamentum flavum running in the back of the spinal canal. So you really have tons and tons of collagen in the spine. If you don't eat enough fruits and vegetables, you can be a little bit mildly scurvy-like, if you will, vitamin C deficient. That'll also contribute to poor collagen. So you can see by eating organic vegan, you're helping this in multiple ways. Number one, you're going to have plenty of vitamin C. Number two, you're going to avoid the glyphosate, which can damage your collagen. Number three, you want to filter the F- out of your water, and you won't get the F- effect of damaging your collagen, because those will all contribute to this. Here's the vertebral body, and the center of it, we'll call it the center of the vertebral body. Let me shrink my picture here. You got better blood flow. The lowermost and uppermost part of the vertebral body have what's called endocrineal ossification, forming from originally cartilage, and they're like apophyseal equivalents, which is a fancy way of saying they're like the growth plate in your in all your long bones, and so they don't have as good a blood supply as the more central part of the vertebral body. So that's sort of the point. You don't have great blood supply to begin with going to these end plates, and then you have even worse blood supply going to the disc, just a little diffusion, because in nature we're not supposed to ever get atherosclerosis. Okay, so anyways, what will happen is a person will injure the disc at one level. By the way, this term annular fissure used to be called annular tear, so it's just a little tear in the posterior disc, and you'll see high signal intensity, sometimes called a high intensity zone on a T2 weighted MRI. But the bottom line is this: the disc normally evens the distribution of weight as a person turns from one side to the other side, bends forward and back, and it really helps to support a lot of the weight. So when you tear the disc and it's no longer functioning effectively, the bones have to bear more weight. When the bones have to bear more weight, they'll start to lay down calcification, which will then become progressively mineralized bone matrix, bone osteoid, and you'll form these bridging osteophytes, bone spurs. Okay, and once you form bone spurs to fuse this segment, because the spine is, the joke is it's like the hedgehog. It has only one trick, but it's a good trick. Whenever there's abnormal motion at a spinal segment, meaning between two vertebral bodies and a disc, the spine has lots of proprioceptors because it has an important job. It protects the central nervous system, your spinal cord. So it doesn't want abnormal motion. It will lay down calcium and bone matrix to fuse that segment. So you're going to see this in a moment, these fusing osteophytes. And when that happens, this disc no longer contributes very much to distributing the weight evenly and to bearing the weight. So now there's going to be increased pressure on the adjacent disc, the one above and the one below, and these will have a tendency to degenerate. A degenerated disc often has a loss of height. It'll sometimes get gas, like a vacuum-like effect of getting, we call it gaseous disc degeneration. So the point I'm making is, let's say this disc degenerates. Now you're going to have to bear more weight and stress on the disc below and the disc above, so they'll tend to fail. And then that same process will march its way all the way up and down the spine. There were some papers, like back in the 1980s, talking about ischemia as contributing to degenerative disc disease. But I did figure out that it's not just degenerative disc disease in the lumbar spine. It's the entire spine. And not only do you form bridging osteophytes, you'll form ossification across the disc space. It's called interbody fusion. You'll lay down calcium typically along the posterior surface of the disc, and they'll often call that a calcified posterior disc margin. But you'll also form osteophytes here. We'll often call that a disc osteophyte complex. And then over time, it'll get bigger and completely fuse and even extend above and below the vertebrae, especially in the cervical spine. And that's called OPLL, ossification of the posterior longitudinal ligament. And, just to give you a sense of how ridiculous the textbooks were, if you read a textbook from, let's say, the 1990s, it'll tell you OPLL, ossification of the posterior longitudinal ligament, right around here, is a rare condition found most commonly in Asian populations. And that's all BS. I see it every day, multiple times every day. It's very common. Okay. I'm going to show you another picture here that's going to show you more like what it usually looks like. So here's a typical spine I see all day long every day. These are degenerated, failed discs, and then the spine has compensated by fusing them and forming these big, bulky bridging osteophytes. So it can form them anterior, they'll form them on the side. We usually call them DISH. DISH is means it's an acronym: diffuse idiopathic skeletal hyperostosis. Okay, and they've also found that if you, in Europe, they had to dig up a bunch of graveyards for construction purposes, and what they found was that in the graveyards that were of the rich people that were eating meat and had more of a diet like that, drinking a lot of beer and whatnot, they had lots of DISH. Okay, but in the populations where the peasants were buried, they're just eating turnips and plant foods, they had hardly any DISH. Okay, so that's another confirmation of it. The other thing I'll see, and I notice this, and by the way, I wrote all this stuff up, and I have a whole bunch of neuroradiology friends and neurology friends. Every single one of them says they think I'm exactly right on all my theories of the spine, but when I try to publish it in the journals, they won't publish it. And the reason is, it's not going to change things that much, but they don't even want it published, just people being aware of ischemia being such a major contributor to spine disease, and it should be part of treatment is to optimize one's diet to improve blood flow to the spine, to try to slow down this progression of degenerative disc disease and adjacent segment accelerated degeneration, progressing all the way up to the skull. Okay, so anyways, that's DISH right there at that level, and then the next picture I'll show you even more what it looks like here. And so here it is progressing all the way up and down the spine. And again, I see this every day. The anterior fused segments work their way all the way up and down the spine. We typically call that DISH. Here's interbody fusion, fusing between the vertebral bodies across the disc space. That'll be calcified. Here's OPLL, ossification of the posterior longitudinal ligament, where it initially starts as calcifying the posterior disc margin, and then it gets thicker and bulkier, and you get bridging osteophytes off the posterior vertebral body. We call those end plate osteophytes. So this is like the end stage spine. Oh, and by the way, the abdominal aorta, thoracic aorta is usually heavily calcified because these calcifications, they narrow. The medical word for narrowing is stenosis, the lumbar artery as it goes back to the spine. So as they stenose and occlude it, then it becomes less able to deliver blood to the vertebra, meaning less blood gets to the disc fails, and we start off this, falling domino sequence that basically progressively destroys the whole spine. And this is another reason why I recommend to people, get your act together, the sooner the better, with all your diet, exercise, and sleep, because I see a lot of people with back pain in their 30s, early 40s, and their spine still looks pretty good. There's not irreversible, obvious, visible structural damage, but as people start drifting more into their late 40s and their 50s, I see more and more where the spine's starting to have these bulky osteophytes, interbody fusions, OPLL, and the more this goes on, the more irreversible it becomes. Then what happens is, because their entire spine is all fused, they become kind of stiff, and they walk kind of stiff. They're walking with a walker, and they don't exercise much, so now all their muscles in here are atrophic. And the relevance is sometimes a small fall, just fall back, and they can get a chalk stick fracture, because a normal bone is kind of resilient, and it'll bend. If I can show this as a bending, I don't know if I can get it'll bend, and that's normal. Like, you fall down, you put your hands out, you're okay. Versus these people with these old stiff spines, like here, maybe a blue one maybe, it'll just snap. It'll snap, and that's called a chalk stick fracture. So It's characteristic lesions. I've seen this. I've seen these. I don't see them every day. I see chalk stick fractures like once every couple of months. Person falls back, a minor fall, just getting up, let's say, from their scooter, because a lot of them have a motorized scooter because they can't walk too well, and getting to a chair, they fall back, and they'll hyperextend their spine, and the fracture will go all the way through. It'll find a weak spot in between these bridging osteophytes through the bone. The bone becomes soft because you have stress shielding, because the bridging osteophytes are bearing most of the weight. And the fracture line will find its way through, and it'll dissect its way through the entire vertebral body, and it'll often go through the spinal canal into the posterior elements. And I've seen quite a few patients become paraplegic from this. Okay, so anyways, you don't want to end up like this, all stiff, weak, walking around in a walker instead of walking free on your feet. It's just the way you avoid it is keep good blood flow to the spine. Yeah, all that other stuff is fine for temporizing the pain, trying to get it under control. And, surgery is a pretty big deal. What I've seen is if the doctors are on a salary, they're usually relatively reasonable about when they operate. Some people really need an operation. Their central spinal canal is real tight. But I have seen patients going to private practice hospitals where they're on fee-for-service. And from what I've seen, there is a tendency at some places to operate too much. They want the money. And getting a spine operation is a bit of a big deal because they have to cut through the muscles down here. So once you cut through the muscles, you're always going to have some scarring and stiffness down there. You're going to have some scarring into the central spinal canal. So the bottom line is sometimes you need surgery. The cord's being compressed on, the lumbar spine nerve roots, the cauda equina are being tightly compressed. You might need surgery. Okay, but quite often the findings on the MRI are relatively minor initially, and you might do some of this temporizing stuff, but sooner or later you're either going to make sure you got good blood flow or you don't. And it's so much better to just have that good. I had a lot of back pain when I went through my fat phase in my mid-30s. And as soon as I, became a vegetarian and stuff, all that pain went away. I used to have pain in my feet when I woke up on bed in my 30s. I was hesitant to put them onto the ground because the bottom of my feet hurt. All this stuff went away when I became a vegetarian. I quit eating all the processed food, etc. That was many, many, many years ago, gosh. So anyways, I don't see if I got any more slides here. That's it. So anyways, I hope that was helpful. So the whole point of the talk was just that in addition to all the other things we know, trauma and idiopathic unknown, and then there is ischemia is the most common cause of back pain. It degenerates everybody's spine that gets this atherosclerosis, which is most Americans. And then we talked about avoiding the processed food because of the glyphosate. We talked about avoiding the F- in your water because that also damages collagen. We talked about just eating the plants, you get all the vitamin C, and if you avoid all the atherosclerosis risk factors as much as you can, your spine will be better perfused, you'll be less likely to have back pain. So anyways, that's it.